Are you dealing with hot flashes, night sweats, mood swings, brain fog, or just feeling like your body has turned against you in perimenopause? You're not imagining it. An estimated 85% of women experience noticeable symptoms during perimenopause, and yet most are left to navigate this major hormonal shift alone. If you're dealing with symptoms and wondering whether your hormones might be a little out of whack, I have a free hormone imbalance quiz that I'll be sure to link below. It's helped hundreds of women get clarity on what their symptoms actually mean. Do not forget to take it once you're done watching this video. And if the idea of hormone therapy freaks you out, you're definitely not alone either. For years, women were warned that hormone therapy was dangerous. But the truth is, those fears are often based on outdated or misunderstood data. And what most doctors don't explain, there is a big difference between synthetic hormones and bioidentical hormones. So let's break it down so you can make a confident, informed decision. So why are women so afraid? Well, after the Women's Health Initiative study in the early 2000s, millions of women were scared off hormone therapy. But here's what you probably weren't told. Number one, that study looked at synthetic hormones like Premarin, which is made from horse urine, and progestins, not bioidentical hormones. Number two, later analysis showed that younger women who started hormone replacement therapy within 10 years of menopause or before the age of 60 actually had health benefits, including reduced risk of heart disease, bone loss, and even Alzheimer's. So let's clear up this confusion. What exactly are bioidentical hormones? Well, bioidentical hormones are chemically identical to the hormones your body naturally makes. That means your body recognizes and uses them the same way it would your own estrogen, progesterone, or testosterone. And they can be FDA approved, like estradiol patches and micronized progesterone, or they could be compounded by a pharmacy to create custom doses and blends, like estradiol and estriol creams or low-dose testosterone for women. And I just want to bust a little myth here. Bioidentical doesn't have to mean compounded. Estradiol patches and micronized progesterone that you can get from your regular doctor are both bioidentical and FDA approved. You just don't hear that enough. So what are synthetic hormones then? Well, synthetic hormones are not molecularly identical to your own. They were created to mimic hormone activity, but they bind differently in the body and often come with more side effects and risks. For example, Premarin. It's a form of estrogen derived from pregnant mare's urine. Yes, pregnant horses. It breaks down into at least 10 different estrogen metabolites, many of which your body doesn't even recognize. That's part of the problem. It can trigger unpredictable effects on your tissues. And another example is Provera, which is a synthetic progestin. It's not progesterone. It just acts similarly, but with very different effects on the brain, breast, and cardiovascular system. And here's something really important to know. In many countries across Europe, synthetic hormone use is rare. Bioidentical hormone therapy is the standard in places like France, Switzerland, and Germany, where it's often prescribed early in menopause and with fewer restrictions. Now, before we get into the difference between FDA-approved versus compounded, don't forget to like this video if it helped you understand things more clearly so far. And remember to subscribe for more real talk hormone health without all the fluff. Okay, let's talk FDA-approved versus compounded. Here's where it gets really interesting. FDA-approved bioidenticals are standardized, covered by insurance usually, not always, but usually, and regulated for safety. But doses and forms are limited. If a woman doesn't tolerate the standard dose or formulation, options get tight. For example, FDA-approved estrogen is 100% estradiol, which is the strongest form of estrogen. But in compounded creams, you can combine estradiol with estriol, a gentler estrogen that may be better tolerated by some women. Compounded bioidentical hormones also let you customize doses of estrogen, progesterone, and testosterone. You can adjust for absorption issues or sensitivities. You can create combinations not available in pharmacies. The downside, compounding isn't always covered by insurance, and it's not FDA approved because each prescription is made specifically for one person. It's not mass produced or standardized. Now, I get it. Maybe you're not quite ready to start hormone therapy, or maybe you just want to explore some natural ways to support your hormones first. That's exactly why I created my hormone balancing starter kit. It's perfect for beginners who feel overwhelmed but are ready to take that first step. It walks you through the foundational food, lifestyle, and supplement strategies I use with my private clients, all designed to naturally bring your hormones back into balance. You can find the link right in the description. Okay, so now let's talk about how these hormones actually get into your body, because how you take them can make a huge difference in how you feel and how safe they are. For example, oral estrogen or oral testosterone, not my favorite, especially for women with metabolic or cardiovascular concerns. When taken by mouth, these hormones have to pass through the liver first. It's a process called first pass metabolism. That can raise clotting factors, inflammation markers, and triglycerides. And I've actually seen this firsthand. After a complete hysterectomy, my mom was prescribed oral estrogen, and her triglycerides skyrocketed to over 1,000. Luckily, I had just started my OBGYN residency, and I recognized this as a known risk of oral estrogen. I suggested she ask her doctor to switch to a transdermal patch, which bypasses the liver completely. She did, and her levels came right down. That experience made me a firm believer in choosing the right delivery method for the right body. Transdermal patches are a great FDA-approved option for estradiol. They offer steady absorption and avoid the liver, making them a much safer bet for many women. Creams and gels offer flexibility, especially useful when working with compounded hormones. I particularly love this option for testosterone in women because the doses we need as women are so small. A compounded testosterone cream allows us to start low, go slow, which is what I always say, and adjust the dose based on symptoms and tolerance. That's not something you can do with injections or testosterone pellets. Which brings me to the topic of testosterone pellets or injections. I get asked this question a lot, like, what do I think? They are not my go-to for women. Once it's in, it's in. You're locked into that dose for months, and it's very difficult to adjust if you have side effects or your needs change. Now, I know this can feel overwhelming, especially with all the mixed messages out there. If you're currently using hormone therapy, thinking about starting, or even just have questions, drop a comment below. I read every one, and I'd love to hear your story or help you sort through all this confusion. And if you're done guessing, Googling, and trying to figure this all out on your own, and you're ready to feel like yourself again, I do offer personalized one-on-one support. We use functional lab testing, symptom tracking, and a whole body approach to truly get to the root of your hormone struggles so you can feel better faster. You'll find the link to book a call with me in the description below. So here's the truth. You deserve real answers. You deserve hormone options that are safe, personalized, and backed by science. And you deserve to feel like yourself again. And with that, we'll see you right back here next week. Ciao.